His Excellency, President Bola Ahmed Tinubu, is committed to providing high-quality basic health services that we trust through the Health Sector Renewal Investment Initiative, spearheaded by the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate. In line with this, the National Primary Healthcare Development Agency (NPHCDA) is revitalizing PHCs across the country to ensure quality healthcare services.
The goal of our health sector reform is to save lives, reduce both physical and financial pains, and produce more health for all Nigerians. But to do that, we need to make sure that resources that government is able to pull from all partners and from government resources are judicially utilized. The Honorable Minister used to say a lot that accountability is the missing link in our health system, so much so that it goes, absence of accountability, deny people the very care that they need, desperately need, that government is trying to provide.
About 6-7 years ago, the concept of direct facility financing was introduced to Nigeria, where funds are transferred to facilities for them to use for the operational costs and to make their basic needs to improve service delivery and quality of care. But direct transfer to facility without adequate TA support amount to waste of resources because the frontline healthcare workers are trained to be healthcare workers and not facility managers.
Because the nature of the primary healthcare boards is in such a way that fundings are being received from the national, from the states, from local governments, from partners. Accountability is very, very paramount.
To ensure accountability, transparency, and value for government money at the PHC level, NPHCDA is deploying one Performance and Financial Management Officer (PFMO) per local government area to track the utilization of basic healthcare provision fund to improve service delivery and health outcomes.
As we move on, deploying the Performance and Fiduciary Management Officers will help to strengthen the delivery of primary health care.
The use of this PFMOs provides an opportunity with one in each LGA for us to improve accountability, transparency. Also begins to give the community a sense of belonging, right, in terms of what is going on. And so we look forward as states to working with them to ensuring that the data that they receive or that they collect is shared with the state primary health care development agencies and the ministries so that states as well can make informed decisions, course correct as necessary.
To ensure that qualified persons are employed to take on this very important role, the recruitment process was meticulous and transparent. Successful candidates participated in a 2-day onboarding and training, which commenced on Monday, 19th May 2025 across the states and FCT. The training kick-started with a flag-off ceremony with the NPHCDA, State Primary Healthcare Development Agency representatives, development partners, and traditional leaders in attendance. In his keynote address, Dr. Muyi Aina, Executive Director and CEO of the NPHCDA, described the PFMOs as change agents and urged them to discharge their role with higher standards of integrity, professionalism, and diligence.
It's indeed a pleasure for me to address you and flag off an onboarding of the performance and financial management officers, as this is a fundamental component to achieving the objectives of President Bola Ahmed Tinubu's renewal agenda and Nigerian Health Sector Renewal Investment Initiative. And so one of the reforms that President Bola Tinubu found wise is to build a cohort of young Nigerians who will play a role, who will drive accountability. You all, I'm sure, heard about the Health Fellows program, which is a sister program to the PFMOs. The Health Fellows are basically a cohort of trainees who are being trained to be, public health leaders in Nigeria. You are another cohort who will also, we hope, will engage in the long term and become leaders in the public health sector of Nigeria. But you have a responsibility in helping us improve performance and accountability in the primary health care system. You're not auditors, but you're auditors. You are friends to the staff and to the facilities, but you have a responsibility to help them to do better. What that means is when things are going wrong, you have a responsibility to pick it. You have a responsibility to flag it. Integrity and commitment will be very critical. I congratulate you. It's very exciting times. I think you are part of an elite group of people now in the health sector, spearheaded by my boss, the Quality Minister of Health and Social Welfare, Professor Mohammed Ali. We look forward to the wonderful work that you will be doing.
Stakeholders lent their support for the initiative as a step in the right direction to improve health outcomes in the country.
By deploying this PFMO to the field, they will provide support and transform our healthcare providers at the facility level from healthcare providers to facility managers.
As you may know, we have two agencies working together in collaboration. The NPHCDA, those are the supply side, the NHI, we are the demand side. And in making sure that accountability is ensured in this program, we can see the NPHCDA taking the lead in having the PFMOs in the facility in every local government of the country. And we as the NHI, we are looking forward to work with them as well.
We understand the very critical essence of this role in transforming the primary health care facilities performance, especially in the fund utilization of the BHCPF. And we are also committed to that vision to ensure that that is achieved.
How the deployment of PFMOs will improve accountability and service delivery at PHC level.
Some of their work would include checking with the centers and confirming that indeed they receive the money that is entitled to them, checking that the money is being spent on the eligible items that have been identified for them, and also checking that they are giving out the right output in terms of people that are coming to receive care, and that the care that they've given, that people are actually benefiting from it, and not just that we are being sent numbers of care without being confirming that in reality people are visiting the healthcare centers.
As the onboarding and trainings are concluded across the 36 states and FCT, master trainers and PFMOs share their optimism about learnings and preparedness for the job ahead.
They are going to be asking a lot of qualitative questions, so we are equipping them to sharpen their emotional intelligence skills, so they give us accurate reports.
So far, I've been able to learn more about the origin of primary healthcare and also the aspect of revitalization of primary healthcare, which the government is so much interested in. And I've also been able to go down memory lane from when primary healthcare services started and where it is today. The role of the PFMO and the PHC facilities is provision of accurate data, data collection and reporting, and also monitoring of service provision and ensuring of efficiency of finances in the healthcare. I will be able to achieve that by trying my best to provide accurate data which will be used for reporting and also for decision making.
What I learned yesterday is the interdependence between performance and finance. Data collection and analysis, bridging the gap, supporting the primary healthcare system.
I learned the importance of funding for our primary healthcare system, and most importantly, the ability to account for these funds as they come in. And this is to ensure that there's a continued delivery of quality healthcare service to all the citizens of this nation, Nigeria.
We also make sure that we checkmate every single money that is disbursed and make sure that it's used for what it has been stipulated that it's meant to be used for.
As PFMOs, we are there to ensure that both the financial and the operational activities at the PHCs are taken care of. And for us to support that goal would ensure that resources allocated to those PHCs they are utilized optimally.
This training has actually been very, very insightful because it has given us heads up to what we are going to be working on. It has made us to understand the processes in monitoring and evaluations of the services being delivered in PHCs. And it has also given us insight to what we'll be seeing in the field when we go to field, and how to come in when necessary, and also how to reach out to our supervisors when the need arises.
With Performance and Financial Management Officers, PFMOs, and National Health Fellows working closely together, in monitoring and providing accountability for government investments at PHCs, citizens can further access improved healthcare services.